Imagine, for a moment, a precious little life, just beginning to grow. A baby who should be welcomed into the world with joy, laughter, and endless possibilities. But what if you discovered that this baby had a condition that could impact their future? Meningocele, a type of spina bifida, is a condition that can raise many questions and concerns for expectant parents. In this lecture, we will explore the ins and outs of meningocele, what it is, how it's diagnosed, its potential complications, and the path toward care. Let's unravel the mystery surrounding this condition together and provide you with the information you need to face it head on. What is meningocele? Meningocele is a neural tube defect that occurs early in pregnancy when a fluid-filled sac protrudes through an opening in the fetus's back. This sac contains cerebrospinal fluid, which normally surrounds and cushions the spinal cord. In meningocele, the spinal cord itself is not contained within the sac. While it may sound alarming, many children with this condition can lead fulfilling lives with appropriate medical care. Meningocele is just one of several types of spina bifida, which also includes myelomeningocele and spina bifida occulta. How common is meningocele? According to the Centers for Disease Control and Prevention, CDC, the incidence of spina bifida varies among different ethnic groups. For example, Hispanic infants have a higher occurrence of spinal abnormalities, with approximately 3.8 out of every 10,000 live births being diagnosed with spina bifida. In contrast, the rates for non-Hispanic Black and non-Hispanic white babies are 2.73 and 3.09 out of every 10,000 live births, respectively. These statistics emphasize the need for awareness and understanding of spina bifida, particularly for communities at higher risk. Recognizing the signs, diagnosis. Diagnosing meningocele can be done during pregnancy or after birth. Early detection allows parents and healthcare providers to prepare and create a management plan. Here are some of the methods used for diagnosis. 1-alpha-fetoprotein, AFP, test. This blood test is performed during the second trimester and can indicate potential neural tube defects. About 75–80% of pregnant individuals with elevated AFP levels will receive a diagnosis of spina bifida. 2. Ultrasound. A detailed ultrasound can reveal abnormalities in the spine, allowing healthcare providers to visualize the fetus's condition. 3. Amniocentesis. This involves taking a small sample of amniotic fluid to assess protein levels and determine if a defect is present. After birth, doctors may use MRI, X-rays, or CT scans to confirm a diagnosis of meningocele. What causes meningocele? While there isn't a single cause of meningocele, research has shown that several factors may increase the likelihood of this condition. These include genetic factors. A family history of neural tube defects can raise the risk for the baby. Maternal health. Conditions such as obesity, diabetes, or a history of medications like anti-seizure drugs can contribute to the development of spina bifida. Environmental influences. Exposure to certain substances, including radiation, can also be a risk factor. Nutritional deficiencies. Lack of folic acid before and during pregnancy is one of the most significant contributors to neural tube defects. Folic acid is essential for the healthy development of the fetal nervous system. Pregnant individuals should aim to consume folate-rich foods like beans, broccoli, and oranges and consider taking folic acid supplements as recommended by healthcare providers. The road to repair. Surgical options. Once a diagnosis of meningocele is made, surgical intervention is usually the next step. Surgeons can perform repairs either prenatally or after the baby is born. Prenatal surgery involves operating on the fetus while still in the womb, a complex procedure that can offer benefits but carries risks. If the surgery occurs postnatally, it typically takes place within 72 hours of birth. The procedure involves the following steps. 1. Anesthesia. The infant is placed under general anesthesia to ensure they are comfortable and pain-free during the operation. 2. Surgical repair. The surgeon carefully removes the meningocele and closes the opening in the spine, reducing the risk of further complications. After surgery, the infant will need to stay in the neonatal intensive care unit, NICU, for around 2 weeks to monitor their recovery and provide specialized care. Complications and challenges. While many children with meningocele go on to lead healthy lives, it's essential to recognize that some may experience complications. These can include bowel and bladder issues. Many children with meningocele may have difficulties controlling bowel and bladder functions, which can impact daily life. Mobility challenges. Depending on the spinal cord area affected, some children may face paralysis or limited movement. Infection and bleeding. As with any surgery, risks such as infection or bleeding can occur during or after the procedure. It's important to understand that while these complications may arise, they do not define a child's potential. With proper support and medical care, many individuals with meningocele lead full and active lives. The importance of follow-up care. After surgical repair, ongoing care is crucial. Regular follow-up visits with a team of specialists, including pediatric neurologists, neurosurgeons, and physical therapists, are essential to monitor the child's development and address any challenges. This multidisciplinary approach ensures that the child receives comprehensive care tailored to their needs. Building a supportive network. Living with meningocele can present obstacles, but having a strong support system is vital. Families and caregivers should connect with support groups, online forums, and local resources to share experiences and strategies for managing life with meningocele. Being part of a community can help reduce feelings of isolation and provide valuable insights into coping with this condition. Moving forward with hope. While a diagnosis of meningocele can be daunting, it's essential to remember that many individuals with this condition thrive. Modern medical advancements have improved the outcomes for children with spina bifida, and with the right care, they can lead fulfilling lives. Education, awareness, and early intervention are crucial. By understanding the complexities of meningocele and engaging with healthcare providers, parents can navigate the journey ahead with confidence. Conclusion. Meningocele, a type of spina bifida, can raise many questions for expectant parents and families. By shining a light on this condition, we can help dispel fear and provide clarity on what to expect. From diagnosis to treatment, understanding meningocele is the first step in ensuring a healthy future for children affected by this condition. Remember, you are not alone in this journey. Reach out for support, gather information, and advocate for your child's needs. Together, we can foster an environment where children with meningocele can thrive and achieve their dreams. Thank you for joining me today as we explored the complexities of meningocele. Let's continue to spread awareness and understanding about this important topic.